Hello, my name is Ashley Jeffrey, and I am the Senior Manager of Media Communications for Advent Health West Florida Division. February, of course, is nationally recognized as American Heart Month, and today we're joined by cardiologist Dr. Francisco Delgado, who will be answering some of our most frequently asked questions from our team. And he'll talk about heart failure and how our team is using minimally invasive procedures and techniques to help our patients feel whole again. We invite those of you watching with us today to submit questions in the chat, and we'll take a break at the end to answer some of your questions. Now, we'll jump right into it. Dr. Delgado, what exactly is heart failure?
Good morning. So yeah, heart failure essentially is when the pump is not effectively providing enough blood and oxygen to the body for the body's needs.
What does that mean for the body when that happens?
Well, so multiple organs are affected by it because they're not receiving the appropriate blood flow that they should. And it depends on what kind of heart failure as to which organs are affected by most. Essentially, you could have right-sided or right ventricular heart failure, where you have a lot more of venous or blood is static in the venous system. Predominantly, then you have left-sided heart failure, where you can have it from a weak heart, or even if the heart pumping function is presently there, the heart muscle is working the way it should. It's just not opening as much as it should, and
Got it.
so effectively you pump less blood because of that.
Now, I know you're mentioning the things that are happening inside of the body, but what are some of the symptoms that people should be on the lookout for to know that they may be at risk?
Essentially, like a dry cough, especially if you lay down, it's called orthopnea. If you go to sleep and you can't, you feel like you have to sit up to breathe. Things like that. If you're walking or exerting yourself and you're having trouble breathing, edema, which is swelling mainly of the legs, but it could be abdomen, hands, even your face. You can have swelling there as well. Th- those are the classic symptoms. You can notice that you start to urinate less sometimes, also, and yeah, fatigue essentially.
Got it. So if you're feeling those symptoms, you go to your doctor, your cardiologist. How is it diagnosed? Like, what's the process to diagnose heart failure after you have those symptoms and you go to your doctor?
A lot of it is clinically. If I see a patient in the office and I notice that they have the classic symptoms and the physical exam to match it, it actually happened last week. I had a young patient in his 30s that came in with this, and before I did any of my testing, I already started the treatment right then and there. But usually, we would get an ultrasound of the heart. The most common cause of heart failure ends up being coronary artery disease, so that primarily we also try to rule that out as well. Um,
Got it. So, the diagnosis of heart failure, it sounds very scary, especially when you talk me through some of the signs and symptoms. Can you help educate patients on some of the advancements that we've made in heart care to make the heart failure diagnosis a little bit more treatable?
well, definitely, we have multiple different medications. Almost essentially every day, there's a new medicine that comes out for it. We have various different modalities. We have an advanced heart failure specialty group headed by Dr. Gocha at the Fletcher campus, the main campus. Um, the, things like that we incorporate. Medicines, we do have a device, CardioMEMS. We haven't officially started using it just yet, but it is a device that goes in the arteries of your lungs, and it measures the pressures and different pressures, and it could say if there's fluid overload or not to help guide our medical management that way.
Talk
Um,
us through how patients can reduce their risk of heart failure.
well, reducing risk, for example, obesity, fixing that, the salt intake in the diet. We unfortunately we tend to eat more salt than we should. Um, Exercise helps. Just being cognizant of everything. If you have family history of it as well, that could definitely be something to cue you in to see a cardiologist and establish and make sure everything's going well. If you have any symptoms, obviously, then that needs to be assessed as well.
Absolutely. So the key really is to make sure you get in to see your primary care physician to get you to a cardiologist to make sure we can handle that. Are there any people who are more at risk than others for heart failure? I know you mentioned, there may be some genetic aspects there.
Correct. Yeah, multiple different things. Because you could even have the what I was speaking of before, diastolic heart failure. So you can have what's called amyloidosis, which is protein buildup in the heart muscle that doesn't allow it to function the way it should. Genetics play a big role. Coronary artery disease, of course, as well. All these things need to be assessed.
What are some of the advancements? You kind of spoke to this a little bit about cardiomems, but what are some of the advancements being made in cardiology as a whole that may have you a little bit excited right now to share with patients who may have to come to you for treatment for heart failure?
The medications is the most exciting thing for me, at least, being non-invasive cardiologist. Obviously, for my invasive colleagues going in there, opening up the arteries every day, we also come out with new techniques for doing that to be able to provide more blood flow to the heart muscle itself so that it can function better. We are in the process of starting up the LVAD program as well at the Fletcher campus. So patients that do have their heart failure is so advanced that they require let's say, an external pump per se to help blood flow and everything, and that's being arranged as well.
So I think the big key takeaway for us is that if you have a heart condition, you can start anywhere in the Advent Health system. We're going to make sure we can take care of you and get the
Oh, of
right
course.
expert heart care. I love that. Is there anything else that I may have missed that you feel important to share with our community as it relates to heart failure?
No, just to be cognizant of that, it is scary, especially to have it at first, but there is treatment. And we have noticed a lot of times we can have a very weak heart, and with the medications that we use, you can normalize the heart function. That is very possible. It's just being cognizant of the situation, taking the medications as prescribed are vital. And doing the lifestyle changes, monitoring your salt intake, exercise, fluid intake too. Alcohol, unfortunately, can cause the heart to become weak if you drink too much of it in excess. Things like that.
Excellent. So I do have a question from a viewer. Can you speak about the benefits of the TAVR procedure? And are the medications that will be used and what are the medications that will be used instead of TAVR? Is that your specialty or is that somebody that we can direct this person to?
Oh, yeah. So we do have Dr. Abella. He works at the main campus with us. He does the TAVR procedures there along with the cardiovascular surgeons, the thoracic surgeons. So it's a big team. It's a huge team effort. Patient is involved. They are presented to the team and every aspect of it if they're candidates for the procedure, because not everybody is. But it's mainly for our high risk patients, although that has recently changed as well, where we're starting to address low risk patients because of the outcomes being relatively good and long standing. We're still in the process of trying to find out exactly how long the valves last in comparison to surgically implanted valves. But yeah, we have definitely the team at Tampa that addresses that, and then medications for aortic stenosis, because we're not really doing TAVR for aortic regurgitation just yet. But medications for aortic stenosis, we really don't have anything that is proven to either slow it down or reverse it that we know of.
So the key is to make sure, again, to get to your cardiologist to see what's the right fit for you.
Correct. Yeah, it involves, like I said, the team effort, routine follow up, making sure that the valve is staying stable, and then also maybe even doing an exercise stress test to see if the patient is truly symptomatic from it or not, and if it needs to be fixed at that time.
Excellent. Thank you so much, Dr. Delgado, for joining us today. We appreciate you sharing your expertise in heart care. We want to make sure that if you have any additional questions for the team, for those of you watching, be sure to inbox us a message, and we will be sure to get those answers from Dr. Delgado and the expert heart team at Advent Health. Thank you so much. We'll see you next time.
Thank you very much.